So NCUI's role in MSPI, as I mentioned earlier, is to provide technical assistance to support those 12 grantees as were listed on the previous slide. And through this, we've been able to help in collecting and disseminating information relevant to MSPI through those programs, actually helping those programs collect this information, being able to develop resource tools for MSPI grantees so that they can help in the implementation of the work that they've been doing, and also providing that one-on-one TA support to those grantees. It is definitely, I think, a better approach to work one-on-one with those programs versus being able to provide that overall general TA that the project officer, the MSPI project officer actually offers them. So having NCUI in the place that we can provide that one-on-one assistance has actually been a great help to those programs. Just being there for consultation, or even just being able to help coordinate any peer support with other MSPI grantees. We also have been helping to provide and coordinate trainings. There were several webinars that were performed over the 2013-2014 year. And I've just listed a few of them here, but if you have not been able to actually view these webinars, they are archived on our webinar site, on the NCUI website, as well as our YouTube page. So areas such as looking at evaluation, building evaluation capacity, as well as understanding the role of integration of behavioral health and primary care. Lastly, we've been helping to provide, under providing and coordinating trainings, providing that in-person assistance. So we have been able to coordinate urban presentations at national meetings and conferences, especially in helping those grantees in pulling together an understanding of the work that they've been doing so they can present those at conferences nationally, just so that those programs can be highlighted as well. We've also had some work with SAMHSA and CMS in providing Affordable Care Act. And even though it may not seem related, it does bring in dollars that could help in building those behavioral health departments of those urban grantees. And so that work really was making sure that there was a behavioral health focus of work that's being done through the ACA. And then lastly, here at the annual leadership conference and conferences in the past, there have been breakout sessions for behavioral health communities of learning, as well as MSPI grantees. There's also, as I mentioned, tools that we've been able to develop for evaluation, working one-on-one with programs, really helping them understand the ability to evaluate some of the programmatic work that they've been doing. We've actually been able to create an evaluation toolkit that can also be found on the NCUI website, as well, I think also on the YouTube page, if I'm not mistaken. Helping to promote some of the community training materials that are out there for these grantees, and making sure that they are able to work directly with other grantees, especially for capacity building and working with their local communities as well. And then lastly, there's the Behavioral Health Community of Learning SharePoint site, which really is a site for helping to share resources amongst the grantees, but also amongst all urban behavioral health staff. It's not just for MSPI, but there are specific areas for MSPI grantees as well. And as mentioned, those toolkits and resources are found there. There's also a monthly behavioral health community of learning that was held over the course of the last year, and that was done in collaboration with the Suicide Prevention and Resource Center. Really helping to work with those MSPI urban grantees, as well as the Garrett Lee Smith suicide prevention grantee. So it really was a collaborative effort in helping to bring about having conversations about topics such as evidence-based practices, culturally based practices, and how you can actually implement that into the work that you're doing. So interestingly, the new year for MSPI has just begun, and the role of NCUIH has somewhat shifted, although we are still a part of providing that TA to those MSPI grantees. There are other objectives that NCUIH has been tasked with, and I just wanted to make you aware of some of those in case you are able to provide insight, as well as make you aware of what type of work will be done in the future. And so we have been tasked with providing informational webinars and trainings, including this session itself. And we're hoping to expand upon that in the future with a larger webinar and bringing some of the MSPI grantees onto those webinars to provide that more on the ground work and what's being done in those communities. Also, we've been tasked with being able to develop a Suicide Awareness Day toolkit for American Indian Alaska Natives, so that there's information on IHS's MSPI website and bringing about a better understanding of suicide awareness. Also in developing and implementing an annual National AIN Suicide Awareness Day. And although that seems like a huge undertaking, we are at least making the small steps to make that possibility happen for the next coming year. And it is a collaborative effort with several partnerships, such as SPRC and NIHB and other suicide prevention organizations. We're also serving as an active partner on the Action Alliance for Suicide Prevention. We've been working with the Behavioral Health Work Group with Jackie Mercer, really just making sure that there's a presence on those committees for urbans. Also developing an online suicide crisis awareness response training module that hopefully can be launched in the future. And lastly, as I said, providing that TA to the MSPI site pilot projects. There has been several achievements that have come through MSPI generally, and so just a few are listed here. So actually over 7,500 individuals have initiated treatment for methamphetamine abuse through the funding of those grantee sites. There's been 15,000 substance abuse and mental health encounters via telehealth, mainly through tribal communities, but it is important to note that we are trying to build those telehealth assistance in the urban communities as well. There's been 10,000 professionals and community members trained in suicide crisis response, and over 400,000 encounters with youth that have been provided evidence-based and practice-based prevention activities. So we're actually excited about the work that's being achieved through MSPI, and we're hoping that this funding will remain in the future and be able to be expanded to other communities, as well as the 12 grantees that currently have funding. So there were, I just wanted to give a few examples of some of the urban MSPI grantees work that's been, has been done. But there are 3 sites that I wanted to highlight in some of the examples of the work that they've been doing. The Nebraska Urban Indian Health Clinic, Health Center. They've been doing work through their Soaring Over Meth and Suicide programs through the use of the Wellbriety group meetings that they've been using in order to work with not only adults but youth in understanding how they can actually remain substance abuse and alcohol free, as well as the Hoops for Life event. And then also Fresno American Health Project has been able to develop a phone app in which they have been using for their youth suicide prevention. This app actually is a great tool for the youth in that community to really help them in understanding how they can really work in taking the necessary steps and the choices that they need to reach out to resources that may be available for them when they're feeling down or need someone to talk to. They've also been helping with substance abuse assessments, treatment referrals, and outpatient counseling. And through the funding, they've been able to increase some of that counseling and referrals. The Indian Health Board of Minneapolis, they have a bullying prevention program that they've implemented and developed that actually has been doing very well. And there's actually some information on their YouTube page about some of the work in marketing for that program that they've done as well. And then lastly, they have a Here for a Reason project that they've been expanding upon as well. But I would be amiss if I didn't mention the fact that IHS has revamped their website over the past, I would say 6 months, and they've actually launched a new MSPI website. So I encourage you to go to that website in order to find out information about the MSPI, as well as understand a little bit about some of the other projects that are being implemented through both tribal and urban communities. There is an urban grantee page that actually gives information on all of the work that each of those grantees have been performing over the last couple of years, as well as their contact information. Lastly, I wanted to highlight there is a project spotlight page that NCUIH is really trying to work with the urban grantees in order to get information, in order to make sure that the urbans are also spotlighted on this page. I think in the past it's only been tribal grantees that have been spotlighted on the work that they've been doing, and we really want to make sure that if you are an MSPI grantee and would like your work spotlighted on the home website page of IHS, please let us know so that we can gather all that information and make sure that it is placed on that page. And then lastly, there's a resource page that IHS has that really lists out some of the other prevention initiatives that are out there that could be used, not only for MSPI grantees, but just in general for other urban sites that may want to try to implement some of these projects and programs. IHS actually put out an evaluation toolkit. It's been a couple years, but this could be a resource to help in understanding how to put in place evaluation into your community, as well as understanding how to gather some of the credible evidence that's out there already in making the case for any grant writing initiatives that you may want to use those evaluation initiatives for. There are several resources through the National Suicide Prevention Lifeline, one for a Native Youth Crisis Hotline I wanted to mention, and then also for the National Suicide Prevention Lifeline. And these are just simple tools that could be provided to some of your clients in their ability to reach out at any point in time, 24 hours a day, and helping them work through any challenges or issues that they may be going through. I wanted to mention that the direct contact for MSPI for Urbans is Dr. A.S. Murray. He is the new contact lead that's been on board for, I don't know, maybe a month and a half actually, but he would be your resource to reach out to if you have any questions about the MSPI initiative. And then lastly, if you have any questions following this conference about MSPI or our MSPI grantee, feel free to reach out to Whitney or I. We are in the future hoping to reach out to each grantee just to make contact and provide any updates that may be going on for MSPI as well. So with that, I'd like to say thank you, and if there are any questions that I can answer, I think we have.
Is there any talks or anything on the radar that you're aware of that would supplement some of the counseling sessions to be either comped or to help supplement the cost of some of the prevention services, like counseling services that are needed in the communities? And also for those that are not qualified for some of the low-income programs or income-based programs that are doing the out-of-pocket costs through Connect for Colorado, whatever the urban health care program or insurance carrier is. Do Do you know?
Right, so right now I'm not aware of any webinars that are upcoming, but I do know that there are some communities, urban communities I should say, that have been able to find ways to bill for certain services that ordinarily may not be, it may not be specifically highlighted as a type of service that would be billed for in behavioral health, such as looking at using some of the cultural practices for healing. So we can talk afterwards, and I can try to connect you with some of those or the one community that I know of that has been able to do that. And then as far as the ACA, and if there are actual behavioral health initiatives through it that would help in lowering the cost for those services. I know that through ACA there were several behavioral health benefits that came about, and so it may be such as although I'm not sure, although I have to say that I don't think that it would actually lower the cost, but it actually provides that person the ability to get the care that they may need and for prevention as well as treatment. So as you said, out of pocket probably at this point is the only way that they would be able to cover the cost unless the facility is able to have some type of programmatic work that's already funded to get that done, or there's some type of sliding scale fee that could be initiated.
Thank you.
You're welcome.
Thank you for that.
Hi, good afternoon. My name is Raina. I just had a quick question going back to your factors that prevent, I guess, some of the programs to be implemented, and one of that is the access to care and the lack of providers. And I'm wondering if there's anything that your program has done to actually bring on more providers on board for substance and abuse counseling.
NCUIH specifically doesn't have any initiatives for that, although I will say that the Community Health Representative Project that we've been funded for the last 2 years does have in some ways that ability for those CHRs to then decide that they would want to actually move forward in getting nurse backgrounds or behavioral health backgrounds that could increase the amount of, or the number of professionals at that clinic. I do know that there are initiatives through IHS that actually will repayment initiatives that are out there that are able to help those that are interested in moving forward and getting secondary or further education. But as far as NCUIH itself, we don't have any initiatives in place. But it is something that we're advocating for and definitely stressing, since that's a major way that would help clients feel more culturally competent in coming to the clinic and getting those resources, even if it's outside of the urban facilities as well.
Okay, thank you.
Yeah.